11th of April, and we welcome someone new to the desk, Jackie and Jason.
Ooh.
We do have Dr. Lindsey White is here, chiropractor from Utopia Family Chiropractic, and she's a Palmer grad, which we just found out just a couple seconds ago. Well done.
Thank you.
And we're here to talk about something very important.
Yeah, so for me, why I'm here is I just wanted to raise awareness with kids in chiropractic. Most people, when they think about the chiropractor, you think I have to have neck pain, back pain, or headaches, and chiropractic is so much more than that, and why I'm so passionate about it. It's about helping your nervous system, which most people don't realize what we do. So your nervous system controls everything. It's how your brain communicates to your whole body. So my job is to make sure that all those lines of communication are open so your body gets the right message from your brain and you can function at 100%. So for kids, when we have restriction in our nervous system or stress, they don't function at 100%. So they have ear infections or colic, or they're sick all the time, or kids who have autism and ADHD, they can't focus, they can't communicate with mom and dad, they have digestion issues, they have all these issues, but where it's rooted is in their nervous system, and no one's looking at that. And that's where the chiropractor comes in, because they can look at their nervous system, make sure it's free of all the stress, so that child can function at 100% and just be healthy, which is why I'm here, is seeing Clive and Des Moines and the Metro just to be a healthier place, starting with our kids.
Now, this is Autism Awareness Month,
yes.
as you were telling us in the break. So can you give us an example of how you can help with autism by the use of being a chiropractor?
Yeah, so what I do in my office, not every chiropractor uses this technology, but I have these scans that take a look at your nervous system, which is fantastic. I absolutely love what it does for me and gives you or your child a great picture of what's going on. So they're a thermal scan. They're completely safe. The only thing it probably tickles the kids, they kind of laugh and giggle as I'm doing it, but it shows me where that stress is on their nervous system, and based on that and what I'm feeling with my hands on their spine, I can tell where the restriction is, where that stress is, and help remove it with the adjustments that we do that are completely safe and gentle. And then by doing that, that allows their body to heal, to work properly, to help them with the behavioral issues. So as we adjust and remove that stress, the behavior issues are coming down because their nervous system is clear.
Have you been able to witness this in a personal way of seeing kids that maybe having trouble with that?
Yeah, I shadowed with a chiropractor in Illinois. He's my major mentor. He has the biggest pediatric practice, and hope to bring that here to Iowa someday, to Des Moines, to give this for kids, and just what it does for kids. You know, a child who has autism can't sit down for 5 minutes, but they get an adjustment and they sit there and they can concentrate, they can do their work, they get better grades, teachers report, I don't know what you've done, but this child is different. Mom's coming in, this is a completely different child after one adjustment. Just things like that. It's just absolutely amazing what it can do, and I love seeing it. It's just
there's some people out there that are watching saying, sure, you're going to go to the chiropractor, you're going to crack my kid's back, and he's going to be fine, just like that.
Yeah, every child's different, and one thing we don't ever crack, you know, with kids, how we adjust an adult is not the same how we adjust a child.
What's the difference?
It's so safe and gentle. I got the pleasure of adjusting a 1-month-old yesterday. It was fabulous, but all you do is just a little tiny pressure. So with a little kid, you know, depending on age, the pressure we use is about the pressure to check the ripeness of a tomato. So it's very little pressure, but it can affect so much. Each kid, child, each adult responds differently to chiropractic care. So you'll see little changes, you know, day by day or after each adjustment, but one adjustment isn't going to fix everything. One, you know, it's going to help their body heal, and each adjustment just helps their body work better. So chiropractic isn't making them better. Chiropractic is allowing their body to do its job and get better, and each adjustment builds on the other to help them be healthy and function at 100%. So each person's different in how they respond to care and how better they get with each adjustment. It takes time for your body to heal, and chiropractic helps it do that.
Interesting. I've never heard the autism angle before. Right. We've heard about doing chiropractic on young
I'm just
kids,
curious about how you can do things if you're not manipulating the way you with an adult.
You're still
do you feel movement?
Yeah, absolutely.
You really do?
Yeah, you do feel movement. Like I said yesterday, you know, the parents watching me adjust this little baby, they could never tell that I was adjusting her, except for after I did, she just kind of melted in my hands. It was fantastic. You're just not going to hear the noise, you know, that adults do when they get adjusted, because they have less muscle and less scar tissue built up, because they haven't had the wear and tear on their spines. So it's a lot easier, safer, and it's just easier on me because I just have to use less pressure, because their bodies are so into it. Like, they can just respond so easily, and it's easier for me to adjust because they don't have the muscles that adults do built up, and it's easier for me to adjust, and they respond so quickly to
Just
care.
to clarify, it's not normal to bring a 1-month-old, is it?
Oh,
Or was there a certain
No, that
issue?
you can adjust a baby as soon as they're born. It's fantastic. It's all safe and gentle. Like I said, that's why we do adjust our technique. We use less pressure when we're adjusting a 1-month-old or 1-day-old as opposed to someone who's in their 30s or anything like that. We just use less pressure, and we still get the same effect because we are working on their nervous system, and it has a great effect. But yeah, you can adjust someone. I adjust pregnant women. You can adjust 1-day-old, 3-day-old, 1-month-old, everyone. It's never too early to
And
start
you're just
chiropractic.
basically trying to straighten out the nerve fibers or,
Yeah,
or
so
the
you're
pathways,
just
the
yeah.
pathways.
So all the connections from the body to the brain and vice versa. You
So
just
it's
want to
like
make
if
sure.
a hose is kinked, you're trying to get it so the hose isn't
Yeah,
kinked.
because if the hose is kinked, the water's not getting through
Right.
properly. So if your foot's saying, you know, it hurts, if there's a restriction in the nervous system, that's not getting to the brain, and the brain's not sending the appropriate message back. So we just want to make sure there's clear message going in and out to keep all the messages through, so that, you know, they know, like, oh, I can focus on school. Because if there's that restriction, they're not able to focus, they're not able to be healthy. You know, they're sick all the time, or they're not connecting with mom and dad like they should.
Right, and it sounds like you have a
Interesting
lot
concept,
of specialties when it comes to working with younger.
Yeah, and I have taken extra classes. So I'm involved in an online class. It's 120 hours of specific pediatric care. So I've taken extra classes and done a lot of work because this is my passion to help kids. I love helping everyone, but kids are our future. So I just want to make sure that they have a healthy life that we intended, or their parents intended when they created them. So making sure that their life is just awesome from the start is why I'm here, and what I want to do for the community, and just
All right,
save
let's tell
kids.
everybody where your practice is at.
So it is in Clive on University. It is just west of 60th, right past Trustle's Dish. If you're familiar with that area, right close to where Iowa Lottery moved into.
There you go.
Perfect. Well, wonderful. Thank you
Thank
for
you
coming
very
over.
much.
Thank you so much for having me.
Thanks for being here.